Australia has had its worst day since the pandemic began. Victoria recorded 723 new COVID cases yesterday. That's almost 2,000 cases since Monday. There are more than 5,000 active cases in Victoria. 255 are in regional areas. Another 13 deaths were recorded yesterday. 312 patients are in hospital. From Sunday night, face masks or coverings will be mandatory across the entire state. Overnight, new restrictions began in 6 shires, including Greater Geelong. Residents can no longer have visitors or visit others at home. New South Wales has 18 new cases. 4 are linked to the Thai Rock restaurant in Wetherill Park. Another 4 are linked to the Apollo in Potts Point. 2 are linked to funerals in southwest Sydney. 2 are travellers in the hotel quarantine and 6 are under investigation. Hotspot areas in New South Wales are growing. Potts Point, Carnes Hill Shops, Preston's, Bonnyrigg, Wetherill Park, Mount Pritchard, Bankstown City Plaza, Cabramatta and Perisher. If you live in these areas or have visited in the past 2 weeks, get tested if you have any symptoms, even mild. There are 3 new COVID cases in Queensland. 2 are linked to Sydney's Apollo restaurant. The 3rd is a returned overseas traveller. There are now 11 active cases in that state. Here's Nat.
Live now to our team of reporters. First to Nathan Templeton in Melbourne. Nathan, Victorians have been left shocked by a record number of cases yesterday.
Very deflating, Nat, not just because people are sick and dying, but also because there seems to be no end in sight. Theoretically, we're halfway through the 6 weeks of lockdown 2.0, but that will be extended. And in fact, the Premier and Prime Minister are discussing even stricter stage 4 lockdowns to be introduced, and country people are now being affected. The rules aren't quite as tight there, but around Geelong, the Surf Coast and Colac, people can no longer have visitors to their homes. That's as of this morning. And from midnight on Sunday night, it'll be mandatory for all Victorians to wear a mask in public. Former Premier Jeff Kennett told Sunrise, we've got a very long road ahead.
We have 2 issues here. One is to try and contain the virus, and then secondly, we've got to start preparing for re-entry back into life. It is a real tragedy, and I don't see the spread stopping soon. So we're probably going to have to live with this right up until Christmas.
There are more horror stories from the aged care sector, this time from workers here at Epping Gardens. We've got hold of some logs. These are phone calls that were made to the Health Workers Union, and one of them says when no staff turned up, the manager had to call 000. Residents weren't showered or fed. They were left on the floor. I just want to get back to work to help. It's very sad. And just in the last few minutes in the city, protesters who say they are exercising their right for freedom have gathered at the Shrine of Remembrance, a pretty disrespectful place to do it, I would have thought, as well as potentially being unlawful because a number of them were not wearing masks. We're just waiting to hear from police who've just broken up that demonstration about whether there were any arrests or fines. Nat?
OK, let's go to Bianca Stone. You're at the Queensland border as police consider harsher penalties for COVID criminals. Officers are going to crack down on border cheats after these 3 women brought the virus north.
And Nat, good morning. Police here on the border are on high alert. They are thoroughly checking vehicles who cross the border. That, of course, comes ahead of the new restrictions which come into effect from tomorrow morning. It also follows what's been described as deceptive, deceitful and criminal behaviour of 3 women who came into Queensland. Those 3 women, Diana Lassou, Olivia Marenga and another woman, have now been charged. They are facing 2 charges under the Public Health Act. One of those is fraud, which carries a maximum penalty of 5 years behind bars. They will front court on those charges in September.
We review this one very seriously. That's why we've gone to the extent of doing an investigation that ultimately ends up in them being charged and having to go to court on criminal charges.
There is also a second criminal investigation into those women, which is underway. Reportedly, they were involved in some sort of larger crime syndicate. Police here in Queensland are investigating that. Their actions, though, have put a whole community on edge. Thousands of people, well, inconvenienced by this and put at risk. Aged care facilities have gone into lockdown. 2 schools have been closed and people have been queuing for hours to be tested. More than 1,000 tested in that Southside region yesterday. That's exactly what authorities want people to do. They say the more people who get tested, the better. And we should start seeing the results of some of those testings later today. Meanwhile, here on the border, as I say, police are very busy. They're thoroughly checking vehicles coming across the border. We should see those queues start to form throughout the day as people race to get back to Queensland, because from 1 a.m. tomorrow morning, the whole of Greater Sydney, 5 million people, will be locked out of Queensland. Anyone coming into Queensland from that area from tomorrow will face 14 days mandatory quarantine. Nat?
Marley Hogan's in Sydney. Marley, coronavirus is rapidly spreading to new suburbs across the city.
Nat, it is, and it's forced a number of businesses to close their doors temporarily while they undergo a deep clean. Hotel Harry is one of them. We've seen cleaners here this morning starting that disinfecting process. It's not the only place. Tanviet in Cabramatta, Matinee Coffee in Marrickville and Fitness First in St Leonard's are also shut for a deep clean. The virus has spread to dozens of suburbs from southwest Sydney to the eastern suburbs across to the North Shore. There's also a warning out for Perisher after traces of COVID-19 was found in the sewerage system there. Health authorities using every method possible to find out where this virus is in the state and then let people know and urge them to go and get a test if they're showing any symptoms. Now, with the virus still spreading through the community, Woolworths is now asking all customers and staff members in New South Wales, ACT and those hotspot suburbs in Queensland to please wear a mask while in store. It includes Dan Murphy's, BWS, Big W and ALH hotels. The CEO says Woolworths wants to be a leader in the community on this.
We feel we need to role model what we think is the most COVID-safe behaviour that we can role model, and that includes, of one of many things, wearing of masks in the right situations.
It's not mandatory. People will still be able to shop in there without a mask, but the CEO says it is strongly encouraged. That will start on Monday. Nat.
Amanda Backman is in Adelaide. There is a hopeful new development this morning on a potential COVID vaccine.
Now, it is sounding really positive. At the start of July, there were 40 volunteers here at the Royal Adelaide Hospital that were injected with this product called COVAX-19. Now, it is found this vaccine has developed antibodies and there have been no significant side effects. It's been developed by Flinders University Professor Nikolai Petrovsky. The next stage would be to roll this out to about 500 people of all demographics, and that could start in about a month's time. Now, in terms of when we might see a vaccine rolled out to the wider community, Professor Petrovsky says it's promising, but money is the clincher.
We could be 3 or 4 months away if there was sufficient financial resources to do a large trial and bring it to fruition. If we don't have the resources, then it's just going to take longer.
We're talking about $10 million at least. The UK government is committed to this. Professor Petrovsky says he's also talking with the Canadian government, but so far from the Australian government, there has been nothing.
Yeah, but we're now checking with the Australian government and seeing what their response is. Thanks very much to our team of reporters there.
Just checked in with Josh Frydenberg and Greg Hunt. Sent the messages, so we'll see what they have to say. Deputy Chief Medical Officer Professor Michael Kidd joins me. Michael, good to see you again. What do you say to people still going to work despite testing positive for coronavirus?
Look, Koshi, that's absolutely unacceptable. If people are diagnosed with the COVID-19 virus, they are required to be in strict isolation at home, and there are no exceptions. So people must not go to work, they must not leave their homes, they must be in isolation. Yep,
don't be a hero. Were you shocked at Melbourne's figures yesterday? 4th week into a lockdown, meant to be flattening the curve. Are they doing enough?
Look, I think that everybody, when we saw those figures flash up on the TV screens yesterday, your heart jumped and did feel very, very concerned at what we're seeing. We have to remember, of course, that one day's figures we can't look at on their own. What we need to look at is the trend, and of course we are seeing a continuing upward trend in the numbers of new infections being diagnosed in Victoria. It is now only just 1 week since the requirement that everyone in Melbourne and the Mitchell Shire wear masks was brought in, and as we saw yesterday from the Premier, additional measures have been put in place right across the state to tackle this outbreak.
What about the rest of Australia? I must admit it does worry me when sort of a big corporate in Australia starts recommending people to wear masks, and I'd rather get the information from you than a corporation. Should people in New South Wales be taking a hardline approach with wearing masks?
Well, I think as we've seen in Victoria, we can go from almost no transmission in the community to a very serious outbreak in just a matter of weeks. And we do have some community transmission occurring in New South Wales. The authorities there are doing a great job in bringing that under control. We have seen, of course, yesterday community transmission also occurring in Brisbane for the first time in some time. So these are concerning events. Each business in Australia is required to have its own COVID-safe plan on how does it protect its staff and its customers, in this case the people who are attending one of the supermarkets. So
Yep. Okay. So Woolworths, you're agreeing with them, can impose that. Look, just on this Flinders University program for its COVAX vaccine, we had them on earlier. They need $10 million to fast track it. They've had great results so far. Do you hand out the money?
I don't hand out the money. Actually, I'm former dean at Flinders University, so I'm probably not the right person to ask about that. But what I do know is that the Australian government is working with a number of vaccine manufacturers and developers in Australia and around the world to ensure that all is being done to bring around a vaccine solution to COVID-19.
Okay, all right, we'll continue our chase for it. Thank you for that.